This is Dr. Sam Benjamin. I received a call a month ago in the morning by an otherwise healthy patient who was in Massachusetts on business. She complained of 2 days of clear nasal congestion, mild achiness, a scratchy throat, and a mild frontal, that means front of the head, headache. She called because she got these symptoms every year about this time, and her previous doctor would prescribe a Z-Pak, you know it, azithromycin, and she said it would go away. I explained that I would not prescribe an antibiotic and that she might or might not have a sinus infection or perhaps just a cold. In most cases, regardless of the diagnosis, it was probably self-limiting. Why use an antibiotic unless you developed a high fever and other telltale signs of a bacterial infection? I suggested that she wait a few days, use an over-the-counter decongestant and a nasal spray that she could buy in a health food store called X-Clear, which might help her symptoms. She was adamant. What's the big deal anyway? It's only a Z-Pak, she stated. I advised her that there was a very small but real risk that she could get a cardiac arrhythmia where the heart doesn't beat right from the Z-Pak and suffer sudden death. She discounted its relevance to her. Well, what about Augmentin? And I explained that Augmentin, Simpro, Keflex, and other broad-spectrum antibiotics could increase the risk of C. difficile, Clostridium difficile infection, which causes pain and suffering. It's very difficult to treat. I went on to remind her that people get allergic reactions to various antibiotics, which, while rare, can be life-threatening. Last, but by far not the least, is that there's a growing worldwide resistance to antibiotics that thousands are already dying from, resistant bacterial strains that are untreatable, the result of the needless use of antibiotics in humans and animals, causing germ mutations, making them resilient to antibiotics. She told me that all of this was irrelevant because she had business to conduct. She was not out to save the world, she reminded me. Her concluding remark was an eye-opener for me. Well, she said, I have work to do here in Boston, and if you will not give me an antibiotic, I will just go to an urgent care center and get a prescription. It was a threat. She hung up on me. I learned today that she did go to an urgent care center and was given a prescription for a Z-Pak. That's what she wanted. On her third day of therapy, she fell to the floor while giving a presentation, and she passed. She died. 48-year-old wife, mother of 3 children. Was it the Z-Pak, another cause? I don't know. But why would you take anything that could kill you or make you sicker if you do not absolutely need it? We have a terrible problem, and doctors, patients, we're all to blame. Medicine has trained the consumer to assume that antibiotics can cure anything. Wrong. Consumers want fast fixes, in this case to cure a cold, and demand treatments. My advice? Less is more. Less use of antibiotics may mean better health and more natural resistance. Only take something that you really need. Only take something you really need. This is Dr. Sam Benjamin with what medical news you can use.